Hi, I'm Mehul Mankad, and today we're talking about mental health treatment options. When people are troubled by emotions, thoughts, or behaviors, they have so many options. One option, maybe the most common one, is to keep the suffering to yourself, hoping that things will get better. But they often don't. The next place a person may turn would be to a spouse, a family member, or a close friend. Spending time with a person you trust, a person you feel like understands you, that can be enough to help someone out of a dark place. But what if that's not enough? Some people may turn to the clergy. Of course, that option of turning to someone in the church only works if religion is part of that person's life. For others, they may turn to an authority figure, maybe a teacher, a coach, or someone like that. But what if all of those attempts don't work well enough? What if they're still suffering or getting worse? What if the thing that they're suffering from is something they don't want to discuss with anyone they know? Maybe they feel too embarrassed to talk about it. Today we're going to talk about mental health treatment options. It's often a very big step for someone to seek treatment from a mental health doctor, and I'm talking about anyone. Now let's think about veterans. Here's a person who prided themselves on being physically and mentally stronger than the average civilian. Here's a person who was told to suck it up and show no weakness when they were in training or on duty. They may need to be persuaded to even step in the front door of a mental health doctor's office. As a veteran service officer, you may be in exactly the right place to encourage a veteran to take that step. Let's take a closer look at what happens in a mental health evaluation. If you know what a mental health doctor is going to do, you can help predict things for your veterans and possibly ease their concerns. Or you can get rid of some common myths before they abandon the idea of going in the first place. Routine, outpatient mental health evaluations usually happen in clinic settings that look a bit like a cross between a doctor's office and a living room. By the way, I don't think I've seen a couch in a mental health doctor's office in decades. There's usually a few comfortable chairs, a clock, a desk, a computer, things like that. Mental health clinics run on a pretty fixed time schedule. Unlike a primary care doctor's office where there will be nurses running around and blood being drawn and other tests being done, the mental health doctor can only see one person at a time. That means they really need that patient to be on time or a few minutes early to every appointment. Most visits have a pretty firm start and stop time, and it's perfectly fine to ask in advance how long the visit is going to be. That's also different from a primary care doctor's office where your visit could last anywhere from 5 minutes to a half an hour. Now, the first visit with a mental health doctor is usually a long one. It could last an hour or more. The return visits may or may not be shorter, and the time between visits could be a week, could be a few weeks, could be a few months. It really depends on what kind of treatment the person is getting. For veterans who don't feel like they're very good at talking about themselves, it's fine to bring somebody else to the visit, like a spouse or a close family member. But don't expect that the mental health doctor is going to agree to have the spouse in the room for the whole meeting. In fact, some mental health doctors won't want the spouse in the room until later on. They want to see what the relationship between the doctor and the patient is like without any distraction. And that brings me to my next point, the relationship. This is a big deal. Now, you could have a great surgeon operate on you, for example, and you don't even have to like that person. I mean, it's nice if they're nice, but you're not really hiring them for their winning personality. The mental health doctor, on the other hand, now that is on the extreme other end of the spectrum. If you are their patient, you have to be able to trust them with some really personal stuff. If things go right, you would trust them with things you may not even tell your spouse. How can you trust a stranger more than family? Well, with family and friends, you may have to walk on eggshells around some issues that might bother them. But with mental health doctors, you don't have to worry about that. Another example, what if some of the problems you have are with the person that is the greatest source of support in your life? That's another situation where the relationship with a mental health doctor is unique and can be very helpful. What if you send a veteran to see a mental health doctor and they come back and tell you they didn't like it? A few things could be going on. Maybe they didn't like the questions they were being asked. Maybe the questions hit a raw nerve. Well, tell them that's exactly what's supposed to happen. Send them back and tell them they're doing it right. But what if the problem they have is with the relationship with their mental health doctor? What if they don't like the person they're assigned to talk to? That's a different issue. The veteran now has three choices. One, they can just not go back. And that choice is often accompanied by the veteran not telling the mental health doctor that they're not coming back and also not rescheduling with the new mental health doctor. I don't like that option. The next choice is to keep going but not get too involved. They can keep the mental health doctor at arm's length and just kind of go through the motions. Now you know that that option is not going to help the veteran very much. The third option is the hardest one. This option involves going back, looking the doctor in the eye, and telling them that there's something wrong with the relationship. Now, if they're worried about the doctor's feelings or they're worried it's going to get awkward, tell them not to worry. All of those mental health professionals are taught in school how to handle that particular conversation. Maybe the relationship problem is a minor issue that could be clarified quickly. Maybe it's deeper, and maybe it's related to the exact reason they're coming for mental health treatment in the first place. In the first interview, the mental health doctor is going to try to get enough information to satisfy several agendas. The first one is to hear the person's story. The mental health doctor tries to create a safe environment for the new patient to share the reason that they're seeking treatment. The background question in their mind is, why is this person coming now? Now, this is an important question because most mental health problems have been present for months or even years before a person seeks treatment. The next bit that the mental health doctor will want to know is the person's background. This is a so-called past psychiatric or past medical history. Have they had mental health treatment before? What kind? Were they ever in a psychiatric hospital? Did they ever try to harm themselves? What sorts of medical illnesses do they have? Unlike some other doctor visits, mental health folks are also concerned about social issues. Who lives at home? What are the family finances like? Who pays the bills? Are there any legal issues? Is housing safe and permanent? Mental health doctors will also want to know things like medications and allergies and those sorts of things. Now, in addition to, or instead of doing a physical examination, the mental health doctor will do something called a mental status examination. They'll want to know about the presence or absence of any dangerous thoughts, hallucinations, or other disturbances that need immediate action. They may also test things like math skills, language, or memory. It sounds fun, doesn't it? Now, at the end of all of this, they put all the information together and create a diagnosis and a treatment plan, just like any other doctor. And it's just fine to ask them what they think. So what kind of folks work in a mental health clinic? There are a lot of letters after people's names, and it's hard to decipher all these different types of healthcare providers these days. I'm going to go over some of the more common sorts of providers that your veteran may encounter. I think the two that are best known in mental health are psychiatrists, like me, and psychologists. Psychiatrists are medical doctors or physicians who went to medical school. After they finished medical school, they went to 4 or more years of training to become psychiatrists. They can diagnose mental disorders and treat them with medications, counseling, and some other approaches. Now, because of the way healthcare is structured, psychiatrists are increasingly used by the healthcare system for the most difficult patients or to make diagnoses and use medications. These roles allow the healthcare system to use psychiatrists in places where they're needed the most. Psychologists also did doctorate-level training in graduate school, but their training is not medical. They can diagnose and treat patients, but they don't prescribe medications in most states. Psychologists tend to focus on psychotherapy as the main treatment that they offer. Another thing that some of them do for a living is psychological or neuropsychological testing. So when you're reading records from a psychologist, you might see their regular clinical evaluations, you might see their counseling records, or you might see their testing records. Licensed clinical social workers, or Lcsws, are another common mental health clinician in North Carolina. Not all social workers work in mental health. Some work exclusively in medical clinics or on medical inpatient wards. But mental health social workers have expertise in the mental health domain. Some social workers do things that are specific to their set of skills. For example, the homeless housing programs in the VA system are run by social workers. Other times, their roles overlap with other mental health clinicians. For example, you may find social workers filling the role of psychotherapist in a mental health clinic or a crisis evaluation professional in an emergency room. Nurse practitioners and physician's assistants perform jobs similar to psychiatrists. They often diagnose and treat patients with medications. Sometimes a nurse practitioner or physician's assistant may do counseling, but they usually stick with medications as the main treatment that they offer. And to make matters more complicated, there are several other types of people who might work in a mental health department. 3 other types of mental health clinicians that veterans might come across are certified substance abuse counselors, licensed professional counselors, and licensed marriage and family therapists. Like social workers, these counselors also have master's degrees, and their primary focus is on psychotherapy.